Okay, welcome back, everybody. Welcome back. Thank you for joining us, whether you're on Instagram on our behind the scenes camera or whether you're watching on YouTube or Facebook to get the full scope of the presentation. Thank you for tuning in. Right now, our topic is LASIK and PRK, and we have the expert on that topic with us, Dr. Daniel Chang. He's going to talk about that in just a moment here, but before we get there, I wanted to show you all this awesome pair of Fred sunglasses valued at $700. This is our giveaway for this session today. A beautiful pair, good for men and women. And so if you want to be entered for a chance to win this, make sure you put your names in the comments. And I'm going to put you in our name of wheel of names, and then we can draw your name, hopefully, at the end of the session. Also, any questions that you have for Dr. Chang, make sure you put that in the comments as well, and we will get to that towards the end of the presentation. So I'm going to go ahead and hand it over to Dr. Chang, and he's going to take it away. Dr. Chang, it's all you.
Great. Thanks for having me. I'm excited about the program today, and I do see a lot of gift baskets behind the screen there, so I think it's going to be a good week, and looking forward to the live event tomorrow as well. So I'm going to take a little bit of a turn from what's traditionally considered aesthetics or medical aesthetics and talk about something else that we like to do with lasers, which is vision correction. That all starts with blurry vision or refractive error. So why do you have to wear glasses? Why do you have to wear contacts? Well, even Snoopy had to wear contacts, right? Okay, I'll look over here, you look over there. No, I didn't even know you wore contact lenses. Excuse me, Woodstock is wearing contact lenses. So that's something that affects a lot of us, and this became acutely aware of people who wear glasses and masks during the pandemic. And it's like, you know what? I just don't want to do away with these things. So there are some great options from a vision correction standpoint. So I'll just kind of go over briefly about some of the procedures we do here. Ultimately, for you individually, we like to see you in person so we can give you a personalized consult and tell you what you may be a candidate for and what may work for you. Now, just because you're seeing blurry, it's not always refractive error. There could be other reasons or medical reasons. So you can try to diagnose yourself a little bit, but coming in to let us do the testing that we need can tell you exactly what you need. If it's not a vision correction, there may be some other procedure that can be helpful for you. So in a broad sense, there's different kinds of refractive errors. So if you're blurred because your eyes are focused, there's nearsightedness, there's farsightedness, there's astigmatism, and it all has to do with how the eye works. So the eye is kind of like a camera, right? So there's lenses in the front, film in the back. I probably need to change that because it's not film anymore. It's like a image sensor, and all these cameras in this room making this live. It's funny, my 13-year-old, I don't know if she's ever used a film camera, but she calls it videotaping. I'm not sure where that came from, but it's not much videotaping around anymore. But the eye, the front part of the eye, the cornea and the lens focuses the light so it's sharp on the back of the eyes you see in this picture, and we call that emmetropia. That means everything's in focus, specifically for distance. If you look at somebody whose light focuses in front of the retina, that's someone who's nearsighted. If it focuses behind the retina, that's farsightedness. And if you think about nearsighted, means you can see up close without glasses, you can't see the distance well without glasses. Unfortunately, that way of thinking about it doesn't work the other way around. When you're farsighted, if you're young, you can see distance and up close. And if you're older, you can't see anything without glasses. So that thinking doesn't quite work. As eye surgeons, we think about where's your focus, because the goal is to get the focus right. So you could be nearsightedness, you could be farsightedness. You can also have astigmatism, which is when the light that comes from this direction and this angle focuses differently. So instead of your cornea or your window being round like a basketball, it's oblong like a football. And then you have multiple points of focus, and then that just causes blur for distance and for up close. Now the big thing is we can fix all of that. And most people, for some reason, there's just maybe some like rumor propagator like in fortune cookies or something that, LASIK doesn't work for astigmatism, but it does, and most of the patients I do LASIK on has some form of astigmatism that I go ahead and correct in the process. Just want to touch on something with blurry vision, the blurry near vision or presbyopia. So going back to the wisdom of Charles Schultz, here's Linus talking to Charlie Brown. Do you think dogs change as they get older like people? And Charlie Brown's like, I'm sure they do. And Snoopy here can't read the fine print as well anymore. So for those of you who are in your maybe early to mid 40s or later, you're finding, wait, I can't see up close anymore. And that has to do with the focusing of the lens. So what I've shown you is lens, just the general shape of the eye, but the lens itself actually moves, and that's what makes it a little bit more complicated. But as we get into our 40s and 50s, that zooming goes away, so your lens becomes dysfunctional. You can't see up close as well anymore. You can still see distance. There's different treatments. LASIK and PRK doesn't work so well with that, but there are lens implants, many that we've offered. We've brought a lot through the FDA studies. We actually have a new one in the study right now that does offer you that dynamic range. For those of you who are a little bit older, there are great options for you as well. So ultimately, as I alluded to earlier, the most important thing is to get a consult. So if you're having blurry vision, we want to make sure, why is your vision blurry? Typically, if you're young, you're healthy, it's glasses. But we want to make sure there's not other things going on. So we do very extensive testing, both with diagnostic devices. We look with the microscope. There's myself there on the left and Dr. Gao on the right. He's actually on a well-deserved and rare vacation. He's in, I think, in Amsterdam right now, heading to Paris. So someone who takes his work very seriously as well, but certainly deserves some time off. So again, when you come in for the refractive consult, as I alluded to, we do a lot of testing. So a lot of different diagnostic devices. We do some basic screening the first time you come in just to see, hey, what makes sense, the numbers match up. Eventually, we do a couple rounds of testing. So it's not just a, hey, come in and do the laser same day. We bring you back. You'll see, initially the screen, you'll see one of my technicians. We'll make sure it looks good there. Then you see both Dr. Huggins, my optometrist, and myself, or Dr. Albert and Dr. Gao. And so you'll see multiple doctors through this process before we talk about surgery. From a diagnostic standpoint, the key piece of equipment we use is the iDesign Refractive Studio by J&J. And what this does is it measures the curvature of your eye and also the overall focus. So it gives us a lot of dynamic information. And so a lot of the details of how the laser is guided is generated by this treatment. Now, we don't just believe one machine, we do other tests as well. So this machine actually looks at the curvature, the structure of your iris. So if your eye's rotated a bit, or if you're looking in the wrong direction, we're able to track all of that. So when we're actually doing the treatment, we're able to get that treatment down well. When it comes to treatment options, most of what people talk about is LASIK. And what LASIK is, it's laser in situ keratomileusis. Yes, that's why we call it LASIK, is we lift the protective flap on the cornea and then we laser the inside. Now, you don't have to worry, you're not going to see things coming at you. There's no needles and blades coming at you. It's all done with lasers. But you'll lay there, you'll see some shapes and blurred vision. Your eye's numb. Well, you have the option of having some Valium on board. But when I'm doing the treatment, the actual flap creation takes about 13 to 14 seconds. And the actual reshaping time takes probably somewhere in the order of 10 seconds to maybe 45 seconds, depending on your correction. With PRK, for those who aren't candidate for LASIK, instead of making a flap, we do the treatment right on the surface. It's technically a little less invasive because they're not making the flap. That flap doesn't have to heal, but it does take longer for that surface to remodel and smooth out. So that's one of the things we figure out when you come in for a consult is, hey, what are you a better candidate for? Ultimately at Empire, our primary goal is to give you your best vision in the safest way possible. Now, if we can do it conveniently and give you a quick turnaround with LASIK, we like to do that just as much as you. But for some patients, for various reasons, if they're not a good candidate for LASIK, cornea is too thin, the shape's funny, there's dryness, there's other anatomical or other considerations, we may do PRK as instead. And the vision you get with PRK and LASIK, if you look at a month, 3 months and beyond, they're the same. They're just as good as each other. It's just that LASIK is a little more convenient. So it's also easier to say, and it sounds cooler, so that's why we always talk about LASIK. But bottom line is, when you come to Empire, what we do is we give you what makes sense for you. Now, if you're not a candidate, we'll tell you you're not a candidate. We'll tell you why. But if you're a candidate for a laser procedure, we'll tell you which one, and we'll tell you more details about that. And if you're not a candidate, but something else may help you, we'll tell you for that as well. So when we do LASIK, there's a couple different lasers involved. This is the IFS Advanced Femtosecond Laser. There's also the STAR S4 iris registration excimer laser, which is a infrared laser and a UV laser. But basically, one makes the flap, one reshapes the eye. This is the same system that's used by the U.S. Department of Defense, specifically in the Navy, for the Top Gun fighter pilots who are putting planes down on aircraft carriers. Actually, a number of my colleagues I've talked to from San Diego. They use the same system, and NASA uses the same system for vision correction as well. So we have access to the latest technology from a vision correction standpoint, using both flap creation and eye reshaping technology to give you the best outcome possible. Now there's me doing the procedure. So you see a patient laying there. They have some Valium on board. We have the eye numbed up. Right now, we're not requiring masks for patients anymore, but this was taken a few months ago. But basically, they're lying underneath the laser. It's not like an MRI where you're all wrapped up. It's pretty open. Patients are comfortable while we're doing the procedure. And also, the picture on the right is actually, this is slightly out of order. The picture on the right is when I'm making the flap, and the picture on the left is when I'm reshaping the eye. So quick and painless. Most patients don't, they're nervous beforehand, but when they go through it, they say that was pretty easy. When the numbing drops wear off, there is a little bit of scratchiness afterwards for, in the first hour or two, but usually we have you go home and take a nap and kind of sleep through that time. By the afternoon of surgery, most people are feeling great. And next in the morning, most people come in are 20/20 or pretty close to it. And so we'll see you then, and it continues to improve over the first few weeks. So these are a few people who've had LASIK, and just from a, I guess from a marketing standpoint, we actually made these little things. We had them up on billboards, but these are actually staff members, and I think that says something, because when you look at people who see patients with LASIK, people within the field doing LASIK on themselves, that really says something. So we have Asta, we have Robin, we have Agnes, many of whom are still with us, who see really great, and they've seen enough patients with LASIK that knew this is what they wanted. Now, if you want to take that to the next level, these are several doctors in the community who've had LASIK, who I've done LASIK on. So Dr. Ng from Lee and Lee Optometry, Dr. Hickson, she recently moved out, or she moved out of town. Dr. Takar as well with Takar Optometry. Great doctors. They've seen a lot of patients. They wanted to get out of their glasses and contacts, so they have LASIK as well. There's actually other doctors as well that I've worked on who aren't here. But when doctors start working on themselves from a vision correction standpoint, you know that it's safe. And what I usually tell patients is, laser vision correction, one could argue, is the safest and most successful medical procedure in the history of medical procedures. It's an amazing set of procedures. That being said, it's a medical procedure. There's nothing that's perfect. There's a risk to everything we do in life, and that's why you want to trust us with your vision, because we take your vision very seriously from the very first visit, from the diagnostic testing, the screening, seeing the doctor, telling you about the issues, and doing the best surgery possible, and also providing you with the best post-operative care to make sure you get a great outcome. So again, lots of very happy patients, and we have some special pricing here. I generally don't talk about pricing, so I don't know if Alex will take over from here, but it's sitting right there. We have a special MAB pricing, so it's a great opportunity for you, if you've been thinking about it, to go ahead and sign up for that. I think that's all I have here. Is any questions?
We do have one question about astigmatism. How does LASIK work for astigmatism? I guess this person in the past has been told that she cannot have potentially have LASIK for astigmatism, but is that generally true?
That's a great question. So astigmatism is a generic description, as I alluded to earlier, of the shape of the eye. So instead of being perfectly round, it means it's a little bit oblong, more like a football instead of round like a basketball. And astigmatism is very common. About a third of the patients have at least a diopter of astigmatism, but almost everybody has a little bit. And the beauty of LASIK is when we map the eye, we map not only your nearsightedness, your farsightedness, and your astigmatism, we map a bunch of other higher ordered things that we don't even regularly describe. And when the laser goes down, it treats all of it. So yes, LASIK does work for astigmatism. And I'm not sure, as I alluded to earlier, that there must be some little elf out there saying you can't have LASIK for astigmatism, but it works great for astigmatism. Now, there's a small type of astigmatism. There's a small subcategory called irregular astigmatism. If your cornea has some goofy shape, conditions like keratoconus, boosted marginal degeneration, and other things, those are one of the things that we screen for when we're doing the screening to make sure you don't have the irregular astigmatism. Because that might mean there's a stability issue with your cornea, in which case we wouldn't do at least certain types of laser. So bottom line is, if you're not sure, come in. We'll take a look and we'll tell you if you're a candidate or not. But most people are a candidate for something if you're wearing glasses. And astigmatism is definitely not a reason not to think about doing laser eye surgery.
All right, great. And is it generally recommended to have a consultation before buying? Is it required? I guess I can answer that question for folks. I would go ahead, if you're interested in LASIK, go ahead and give us a call and take us up on this great offer that we have going on through the end of the week. And we will at that point certainly schedule a consultation with you. If it turns out that you are not a candidate, we will most certainly refund you your money. But I think since this is a once a year offer, it's well worth taking advantage of, getting on the schedule for a consultation, meeting our doctors, talking about your specific situation, getting the testing done, and seeing if this is a good option to help you reduce your dependence on glasses and contacts. All right, I'm not seeing any other questions. So Dr. Chang, thank you so much for taking time out of your busy schedule today. I know you were seeing patients all morning, rushed over here to make it to our live stream. So we definitely appreciate that. And thank you for sharing your knowledge with all of us today. So
Thanks for having me. This is what I love to do. I could do this, and hopefully it'll be informative to some of you, and happy to meet you in person and help you see better.
Okay, thank you so much. All right, now comes the big moment that a lot of folks have also been waiting for. So they want to see, have they won this beautiful pair of Fred sunglasses? Nice thing about LASIK, you don't need to have prescription sunglasses anymore, potentially, right? If we can get that vision corrected for you, then you are all set. You can wear any pair of sunglasses you want. So let's see who gets this pair. Here goes the spinning wheel. And it's going to land on Erica Erb. Congratulations, Erica Erb. Congrats. Not sure if you're on Instagram, Facebook, YouTube, where you're watching right now. Go ahead and send us an email, info@empireinlaser.com, info@empireinlaser.com. Let us know that you are the winner, and I will connect with you about getting you this pair of sunglasses. So thanks again. Thank you, Dr. Chang. And everybody come back here in about 10 minutes or so for our final live stream of the week, which is about Sculptra, a wonderful collagen boosting injectable treatment that you're going to definitely want to learn more about. So thanks, everybody, and we will see you soon.